All right. Well, welcome everyone. Thank you so much for joining us today. My name is Ezra and I'm part of our career and professional development team here at WGU. And today I am super excited to introduce WGU alumna Jenny Parker, who is at American Senior Communities and will share some, I think, fantastic information with us today. So Jenny, I'm going to go ahead and hand it over to you.
Yeah, thank you, Ezra. And as Ezra stated, I'm very, very excited to be here. I am a WG proud alum. I graduated a couple of years ago with my MBA, so just very excited to be here. Thanks for having me. I've initially done another presentation similar to this on the essential skills in long-term care leadership, and just really excited to share it again. I initially actually started in long-term health care about a couple decades ago. I started in direct patient care and then kind of got in the recruitment HR side of things. So as I said, thank you again for having me, and let's get started. So my presentation today on essential skills in long-term care leadership kind of goes over a little bit about just what's kind of needed in the long-term care environment right now, as far as hard skills, definitely some soft skills. I'm kind of talking over the market and its demand, and then even just kind of going over what skills are really needed in this particular industry. We'll talk a little bit about how to build on those skills, and then just leadership opportunities that we have at ASC. I'll share some final, kind of tips and takeaways that you can take with you after this. And then, of course, I'll have my contact information at the end there. You're more than welcome to reach out with questions. But then, as Azra said, we'll have a Q&A session at the end as well. So I know I did a little kind of mini introduction a bit on, who I am and where I came from. So with American Senior Communities in particular, um, we have been the top provider of senior living care in the state of Indiana. I see everybody's from everywhere, which is fine. I'm actually based out in Indianapolis right now, and we are the top provider of senior care in the state. We do have 100 locations throughout the state, and that includes kind of the full spectrum of senior living care. We've been in business for about 25 years. We have skilled nursing and assisted living facilities, as well as long-term and short-term rehab services, memory care, independent living. We do partner with a hospice and home care provider called a new hospice as well. And our corporate home office is in the Greenwood, Indiana area. ASC, we are very, very blessed to have won many distinctions over the years, including but not limited to the Best of Indy category in nursing homes, as well as assisted living homes. And then we were reported in by News and World Report as one of the top nursing homes in America. So that was a really great distinction as well. Of course, ASC typically thrives on its leadership in the clinical space, but we do have a lot of non-clinical opportunities available as well. So I'll talk a little bit about those opportunities and what you can expect, what type of disciplines always help that you come from, and how we can kind of build on those skills. I want to talk over too, like what you can expect from the long-term care environment for those who've never had that previous experience before. Really, what is a distinction from us as opposed to other aspects in the healthcare field is unlike acute care, maybe hospice, you really do have that opportunity to build long-term relationships and really connect with the people you serve. So we are all about like just building those connections. You may not have a chance in acute or rehab sometimes because your patient load and residents can always change. But we are always very proud of the fact that we can build those relationships. Our people know us, we know our people, and it's always just a great distinction compared to other like fields in healthcare. Another thing that you can expect from the long-term care environment is a team that really comes together that consists of multiple disciplines and skill sets. I talk with my college students all the time. They always think, oh, like I'm not in the clinical space or I'm not in health sciences. That's okay. We have a lot of different disciplines and studies. A lot of people come from a lot of different walks of life. Before actually I was in healthcare, I was had a liberal arts degree. So we all come from different subsets and different skills. But including in all of that, just to kind of frame a little bit of like what you can expect, just within one of our communities, we have departments such as human resources, of course, clinical, as you would imagine with nursing, social services, activities and programming, psychology, sociology, nutrition, marketing, sales and business, memory care, just a lot of different kind of sectors there that kind of bring us together and really as just a basis in our passion in this mission-based work of serving our seniors. When you think about long-term healthcare, and many of you that probably know this, another important thing to bring up is the demand. A lot of people right now, especially my nursing students that I consistently talk to, they really want a stable career choice. So that's one thing that's another great thing about long-term healthcare is it is so needed. We are so in demand of just wonderful people who really are about this mission-based work. Some things that are kind of helpful to know as far as long-term care demand is there will be more than 3,000 new nursing homes that would need to be built to keep up with our current demand as the older population, especially those baby boomers, expands. The US Department of Health and Human Services do estimate that the person just turning 65, which is fairly young, has still a 70% chance of requiring long-term care services at some point. So we have people that will do long-term care, we'll have people that do rehab, but at some point they're going to need some type of provider needing to give those services. And so as you think about that, coupled with that, we have such a nursing staff shortage at this point, and colleges are unable to kind of keep up to extend the capacity needed for this demand. It does make it a struggle to kind of really hire all that is needed for the possible care in these environments. So the period of where we went through COVID also left a lot of our current nurses and people who had been in the field for a long time. It made them feel a little bit burnout, wanting to kind of take a pause from healthcare and the industry. And so we're seeing that population come back a little bit, but long-term healthcare is always going to be in demand. It's always going to be something that we are like kind of struggling to keep up with a little bit just because that need is so great. And so one thing that I always say to people who are considering long-term healthcare is the biggest thing that you really need is you need to have a passion for mission-based work. This is all about caring for our seniors. And if you can keep that in mind with what your position is, then it's something that you feel a calling to and you just really feel driven by that mission, then it's definitely work that you need to consider. So definitely, I would say the first essential leadership skill needed in long-term healthcare is just the passion for that need, the passion to serve that population. I will say for a lot of our staff, um, it really, and for myself actually included in that, what kind of drives us to come into this industry initially is just a personal connection that we had with a senior in our own life. So I had a great and just a very significant relationship with my grandmother. And I began to care for her when her health was declining. And so just a passion for that work, a need to really be involved, a need to work with that population and care for them and make sure that they have all the resources they need to have a healthy life is what really drives a lot of us in this field. Another thing is the ability to use critical thinking skills. Of course, that's a given, right? Especially when you talk about clinical positions. It's really the need to kind of really come up with some problems and how to solve them. and asking those questions before, it happens. So it really has the ability for people who are really good at just problem solving and know how to really, find a solution to something really at a moment's notice sometimes. It's also something that, there's a lot of variety in our role day to day in long-term health care. You could have one thing, on your mind that you need to accomplish for the day, and then something kind of, definitely comes and kind of interrupts that. And so you kind of have to be very flexible in your ability to kind of solve different problems and just be very flexible on what the environment calls for, especially if you have colleagues who kind of need your assistance. I was a certified nursing assistant for 8 years before I went into human resources. And it was just, you saw variety every day. You maybe had some goals and a list that you needed to accomplish, but if somebody needed your assistance with a resident, or if your resident just really called you and needed something, you kind of had to drop everything and be there for them. So it really calls for somebody who can have that flexibility and grit and kind of react to situations as they come. Another thing that's really needed for working in LTC is the need for collaboration. As I said, earlier in the beginning of the presentation, there's a lot of different disciplines that come together for the needs of the residents. And you have to be able to collaborate with those partners and really see the full comprehensive care of the resident. So you could be somebody in social services speaking to somebody in clinical or speaking to somebody in memory care. And you really have to not only, talk about what your discipline calls for and what your goals and objectives are, but you have to really see things from a different lens of where they're coming from as well. So that need for collaboration, that need to kind of work together with people who are maybe seeing health from a different aspect is very much needed as well. I say this because, of course, we all know that you'll have certain credentials that you'll need to be in a clinical space, right? So if you're wanting to be a nurse, you have to have that registered nurse licensure, right? The same thing with if you want to be an administrator, you have to have that licensure. But a lot of what I ask people to think about, especially my students, is for essential leadership in LTC, you really have to build off of those soft skills. They're actually just as important, I would even say, if not more important, than those credentialing, the education, the licensures, the things that you need, of course, that might be part of the requirements of doing the job. Another thing that is really important in considering leadership is being an effective communicator. And so that could be on any end that you think about. So it could be with residents, it could be with residents' family members, it could be with staff, people that you're mentoring in their roles. You have to be good at communication. And really, I always tell people too, that starts with being an active listener as well. You have to listen, you have to see where people are coming from. You want to show that you're really actively listening to what their requests are before you come up with a solution. Another thing that I love to tell my leaders as well is we always talked about it when we were CNAs on the floor, right? So I essentially came from memory care. And part of memory care that was really helpful for me in talking with my people from moderate to late stages of dementia and Alzheimer's disease is they teach you something called validation therapy. And what validation therapy is when you listen to somebody and instead of correcting them, you validate their feelings. You understand where they're coming from. You really validate the feelings of like, I understand you're really upset right now. I understand that you're feeling this way. And then before you think about what you're going to say in response to try to support them. So that's another thing that I love to bring up and kind of connect those dots is even though that is a requirement of something I needed to do as part of a therapy of when I was doing clinical direct patient care, it's something I continue to follow with me, even in my leadership roles, even in my human resource role right now. I still use that as a communicator, just like a great way to kind of use as a strategy before I communicate with people I need to. I really validate them. I validate their thoughts. I think about where they're coming from as far as their perspective, and then we kind of go from there. So just want to pass that along because I really think it's really important as far as not only just being a good communicator, but that really starts with being a good listener. Another thing that is really essential to leadership in long-term healthcare is just being a supportive presence, being that person who people can go to. And as I said, just like with the need of collaboration, just like with the need of communicating, this will be for all the stakeholders involved in your long-term healthcare career. So that means residents, that means family members, that means staff, colleagues, leaders that you look up to, just anybody in that environment. It's just being a supportive presence. Sometimes in long-term healthcare, we really have a lot of hats, kind of being like a mom. Like you do a little bit of everything. You help in every aspect of the role sometimes. Just because you really connect with these people, and sometimes they're not always worried about like who's in activities and who's in here and who's in what. So even if you don't know how to like respond to it, you always know who to go to. You do have that supportive presence. You do have several different departments working together, but just knowing that you have that empathy for other people too, and you're always able to kind of lend a helping hand. So even though I talked about all the things and really all the soft skills needed for long-term healthcare, another important thing to kind of go through is like, okay, if I don't really have these skills, how can I build off of them? And there's a lot of different ways that you are able to do that, just within your everyday life and even in your educational career at WGU. So how do you build on these skills? Well, compassion, you can dedicate yourself to a mission. So, we talked about mission based work, whether you've volunteered for a nonprofit, you've worked in mission based work before, just pick a mission that's really important to you or a goal that's really important to you, and just learning to really dedicate yourself to that. So, initially, before I worked in long term healthcare, I was actually a stay at home mom. And so, a lot of times I would start volunteering at different organizations local to me. And not only is that a great way to kind of find a mission, lend yourself to it, and kind of practice those compassion and empathy skills. But it's also a great way to network and find out about maybe future positions that might be available to you as well, especially while you're finishing up your education. So I always say, like, dedicate yourself to a mission. It can be whatever mission that you feel passionate about, but that's a really great way to kind of start work that feels really important to you, build off something that is just you feel passionate about. You can get other people involved in it. It's something that excites you. You can always start off by being a board member as well, helping with fundraising, marketing, and even depending on what discipline you're coming from, it's just a great way to kind of practice your skills and those technical skills too, just depending on whatever you're studying. Another thing that I always tell people too, and it kind of goes along with what I just talked about, is practicing empathy and communication is really kind of going through and practicing those active listening skills. And that could be somebody who are other professionals, that could be while you're networking, while you're working with other colleagues, if even listening to your instructors, and just validate other people's thoughts, um, what they're thinking, understanding where they're coming from. And I always say too, if you can mirror people while you're talking to them, especially when you're networking, try to like have those active listening skills, mirror what their expressions are, even repeat back to them some phrases so they know that you're actively listening to what they're saying. And that's always a great kind of just leadership antidote too, is if you can listen to a team member coming to you about a problem, just making sure that you repeat back maybe what their issue is. And that's always making sure that not only are you communicating clearly, but that they know you're actively listening to what they're saying and that you're understanding what they're asking from you. So that's always just a great antidote too. Another way to practice just critical thinking skills is really weighing the pros and cons to each decision that you make. So it may not be, every small decision you make, right? But something that you're kind of struggling with, or you're like, gosh, I really don't know how to solve this problem, but I think maybe this might be the way. I always like to run a list of just pros and cons of like, does this make sense? Does this seem to do the pros really weigh out the cons here? Is this the right decision? Is this really, make sense for the path I'm wanting to take? So I did that a lot with, different job offers too when I was coming from WGU. And just it's a good way to kind of test a little bit on what your thinking is. I would always even say, if not a pros and cons list, it's always good to just write your thoughts down and kind of really understand and organize your thoughts a little bit. Sometimes it helps to get them on paper and it makes things a little bit more clearly. Another thing to build on these type of skills is even just collaboration within your own educational journey at WGU. So reaching out to fellow students, reaching out to your mentors, brainstorming ideas, even maybe talking about those pros and cons that we were talking about if you're kind of really coming up with a hard decision, and just really collaborating with others. Another thing that I really wanted to do coming out of my education at WGU is I really wanted to kind of get myself out there more. So I joined a board of directors, kind of volunteering with a nonprofit organization that really spoke to me. I joined in an association and talked with other colleagues. I became involved in networking groups. So these are all opportunities where even if it's just, before you kind of land that next job, it's just different opportunities that gets you in a room with other people. It gives you a chance to kind of collaborate with them, brainstorm, and kind of really, as I said, just build on that communication piece, the critical thinking skills, and then collaboration as well. Usually on a board, they'll have you do a committee or plan an event. So it's always just a great way to kind of brainstorm and use all the skills that we just talked about. Another way to kind of build on leadership skills is really like flexibility. I said was really important just because our environment constantly changes, our policies may change, and then especially with like even law of healthcare and how that's kind of going changes too. So just being open to those different approaches and practices. So when you do collaborate with other people, when you do network with other people, maybe take the other spin of what you would normally decide. So just maybe looking at something from a different perspective, maybe, getting those ideas from others and maybe try to take a look at, okay, how would I normally react to this? How would I normally solve this? And then spinning it and maybe trying a different approach, or maybe looking at it from the opposite angle. It's just a good way to kind of build up that flexibility, that grit, that resilience, and kind of giving you a different perspective. And that's another thing that kind of really lends itself to just becoming a good leader, because then you can really see things from another side that maybe you initially wouldn't have opened yourself up to. So as I said, I started my healthcare journey in direct patient care, and that really came from a passion of providing direct care to a personal family member at the time that she really needed it. So it kind of fell in my lap in a way. But when I talk to nursing students and when I talk to other people who've started their educational careers, they always say, okay, well, I'm kind of curious about long-term healthcare. So what do I do now? Like, I'm not really sure where to go with it. So just like myself and others that you may meet along the way, network with professionals in that industry. That's such a valuable thing when you're first starting out and kind of learning, where do I want to go with my education? But I'm curious about this industry. I just don't know enough. Really just try to reach out to other professionals. So anybody who who's in long-term healthcare, or maybe just in the healthcare field in general, maybe you just feel called to healthcare, but you're not sure where to go from there. They can usually kind of pave the way on different different ways that each kind of sector in healthcare is different. Myself, I wasn't always long-term health care. I got to work in home health as well. And so you'll see a lot of people who maybe come from different sectors of healthcare, and they can kind of go through those differences with you. Another thing that is if you're really curious about the environment, you're like, hey, I haven't been in a nursing home since I was, maybe a child and, I was doing it for Girl Scouts or Boy Scouts. So it's been a while. I don't know if I would like the environment. Absolutely. Come take a tour. We always say that at ASC if we have nursing students or just other students in other different disciplines who want to work in the healthcare space. And we always say, come by one of our campuses and just take a tour, meet with our administrator, ask questions, meet with our director of nursing. And they can give you an idea of like what the culture is like in the building, what you can expect from the residents, like all those types of things. And what's even more fun is when you ask them like what activities they have going on that day, because that's always a fun opportunity too. And kind of a perfect segue of that is another way that you can really involve yourself is maybe even just volunteer at a local long-term healthcare facility or nursing home. I always really enjoyed when I worked in a long-term healthcare environment, just taking my kiddos over to do trick or treating with the residents. They really enjoy that. They love seeing little kids. They love that interaction. And even sometimes we'll do our own community events. So we'll have open houses, community events where people can come in and do trick or treating. Sometimes we'll do trunk or treat. Sometimes we'll do a movie night and have an opportunity to where people can come and see our campus and just really spend that time. And then there's always, of course, spending, time with your own senior in your own life, you know what I mean? And just really having that one-on-one time with them. And if that's something that is just really speaks to your heart, then probably long-term healthcare is really for you, or at least should be considered. Another thing that I would say is find a mentor. If you're coming from business, socials, social work, education, nursing, of course, HR, any type of discipline that we would normally see in long-term healthcare. Um, while you're kind of networking with those professionals, pick a mentor with that type of experience and just ask them questions, kind of pick their brain a little bit about the environment, how you can develop your career in that space, what that kind of looks like. Another opportunity too is once you've, completed your education or even while you're still in it, you can always check on LinkedIn, connect with like-minded professionals, and then also join certain associations within the discipline of your choice. So right now, as I said, I'm in talent acquisition, human resources, and I joined an Indiana Association of Healthcare Recruiters, along with a national recruitment of healthcare professionals. And it's been very, very helpful. And it is very interesting too, because you will see like direct competitors with you, but it's always great. I always say if you can get in a room, even with people who are your competitors, and just kind of bounce ideas off of each other. A lot of times we'll refer people to each other as well, as far as residents and the care that they're needing. So don't be afraid to put yourself out there and just really kind of seek a lot of those associations and groups to where you could get a lot of your questions answered. I would say too, with leadership opportunities, I know a lot of people were coming nationwide. Of course, our company specifically is Indiana based, but I would say this is pretty, uh, correlates with really any long-term healthcare facility near you. So I don't think all of them are just, unique to ASC. So just keeping in mind too that a lot of this information can even be practiced for you locally. So leadership opportunities that normally are available in the long-term healthcare space is so many, as I said, in so many different areas. So one is an administrator, and or we also call it an executive director. And that's the person who overall is in charge of the community. So they really have so many hats that they wear within their career. They, of course, look at finance, budget for their community, their staffing, their recruitment, um, just developing the leaders in their building, bringing people together to collaborate to kind of really drive those goals that they're needing, whether it's sales and admissions or it's just making sure all the residents' needs are met. So it's really somebody who's that full comprehensive leader for the entire community. A lot of people in this field come from our business administration students. So I'll have a lot of business administration students come to me and say, I want to do leadership. I want to be a manager, but I don't really know where to go with it. And so I talk to them about our AIT program, which is an administrator in training program that we have. And really, as I said, can be local to you too. A lot of different long-term healthcare environments have training programs for administrators. And that program can look different at different communities, but it's always accessible to you if you're like, I have this degree in business, just don't know what to do with it. Maybe I'd be interested in healthcare. Maybe that's the way to go. So maybe look at what um, programs, specific training programs is available in your area for that. And I talk a little bit about it too in the next slide of what our particular program looks like. Another thing is, of course, all our nursing positions, right? So we do have a lot. I would say within ASC specifically, we have about 9 different leadership opportunities when it just comes to nursing. So of course, us being a long-term healthcare environment, a lot of different services that we provide to our people. Clinical is, of course, makes up a lot of our workforce. So director of nursing, of course, is that administrator, nursing professional who really like recruits, onboards other nurses and staff, really kind of leads to their training and development, really makes sure that our residents are taken care of, meets with families about care. So they're really the leader on the clinical level for us. The administrator is more kind of non-clinical. So the administrator and the DNS work very tandem and together and kind of completing those goals for the community. Another one that's a nursing leadership position is infection preventionist. That's really somebody who really does a lot as far as training and education on how to prevent certain infection with our staff. They're very knowledgeable and very experienced in wound care. So that's really kind of their niche and what they're concentrated on. We also have a nurse who's a staff development coordinator. So this is somebody who is really dedicated to clinical education for our staff, but also, kind of helps with retention of our staff, really developing who they want to become. Do they want to be part of a leadership program? Do they want to be part of one of our several training programs? And they kind of lead the staff in that way. Our MDS and coordinator and our medical records coordinator are people who really make sure our records are accurate. We have surveys, of course, like state surveys, and then we have pre-surveys to kind of get ready for those surveys. It's really somebody who can make sure all our accounts, all of our data, everything for our records and our documents is charted and it's charted accurately. So those are people who are very detail oriented, of course, and are really dedicated to make sure our surveys go really well. As I stated, not only just nursing, but there's a lot of different other disciplines. So we do hire social service assistants. So anybody who comes from psychology, sociology, social work degree, human services degree. We have a director of social services that's dedicated to really making sure that our residents have the resources that they need to really kind of carry, as I said, that full comprehensive care that we're looking for when we take care of our residents. That's really important. We also have for our business administration students or people who are interested in sales and marketing, we do have a director of sales and marketing and admissions person as well. So that's another option at any community. We have HR. So HR involves payroll benefits coordinator, as well as our business office manager who kind of handles the eligibility for a lot of our people as far as care, their Medicare, Medicaid, but also kind of help with our employee records and HR documents and stuff like that, helping onboarding our staff at the building and that type of thing. We also have a culinary manager and a nutrition manager, as well as registered dietitians that we have at our communities too, that really just make sure that we have the proper diets for all our residents, that they're eating nutritious food and eating food that really correlates with the best care that they can receive. So our culinary manager also helps with recruitment and retention of our culinary staff. So they do hire aides, cooks, servers to kind of help our residents prepare their meals and that type of thing. Unit manager is for different things. So we have some for memory care, but we also have some in our clinical space as well. So that would be another nursing position. With the unit manager specifically, sometimes we won't just hire registered nurses in that role, but sometimes we'll even hire some licensed practical nurses as well. So we do have plenty of management roles for LPNs as well. And then another one of that kind of correlates a little bit with what we talked about as far as social services directors. We also have a memory care director. So that's somebody who's on the social services side of our memory care unit. So somebody who's really just passionate about working with our moderate to late stages of dementia and Alzheimer's disease folks, and who feel really committed to that. Who's really good at certain types of therapies, whether it be validation therapy or whether it be like more reality based. But it's really somebody who's kind of passionate about that. And then, of course, we have human service directors as well. As I said, we have a corporate home office, and a lot of our different competitors have this too with different healthcare companies where they will have like a regional human resources director who can help support our HR folks right at the building level. So that's really nice to have as well. So for a lot of my graduates, they'll ask for different pathways, like how, okay, I've done this, like now what do I, what I want to do? I did all kind of the research. I networked with the right people. I, found out what the culture is like. I did a tour of a community. Like now, where do I go from here? Well, a lot of our business administration students, as I said, will sometimes join our AIT program. And so with us specifically, though, you can probably find a local program near you. It is a one-year program with us to kind of learn the skills of becoming an executive director. So we have our own executive directors at several of our communities who are top leaders in what they do. They've been doing it very successfully and running really great communities. And so you really, it involves job shadowing that, kind of see what they do day to day, what operation looks like from their end, all the different aspects into play. Of course, as I said, they have to worry about a lot of different things at the building level. They have to do finance and budgeting and operations and meeting with families and, spending some time with residents and spending time with staff. So it's a little bit of everything thrown at them, but they always do a great job of kind of letting our AIT people kind of shadow them, see what it's like. And then we really have an opportunity too, where you kind of take over the reins a little bit and do part of that job. And really, as I said, that's a year program. The people who are involved in that training, it's free for them. But of course, there is a commitment to us. And then they kind of commit to serving as an administrator at one of our locations. They have to be kind of open to the location, of course, too, just depending on, what availability we have and what staffing needs there are. So another thing that I tell our nursing students if they've taken a tour at one of our communities is even like take the time to maybe like job shadow or kind of train with our DNS and just even learn more about those leadership roles. As I said, we have a lot of different niche like nursing leadership roles with that focus on a lot of different things. So some of them is the minimum data set that we just talked about, the MDS coordinator. Some is staff development, clinical education, just a lot of different types of sectors of nurse leadership. And so if there's one that you find interested, definitely talk with our DNS about it. I'll have my contact information at the bottom or at the end here too. And just always ask questions about it. So a lot of times people will ask me, okay, like what's the next step? How do I apply? If I see an opportunity I just really enjoy, you know, what do I do next? So you can definitely check out our careers website. It's pretty easy. It's to remember. It's www.asdcare.com/careers. We make it really easy on there. Sometimes with how many locations, we have 102 locations. Sometimes it can be hard to find the location nearest to you, but we do have an AI assistant named Rosie on there, and she does make it simple. She helps you out there. So she'll help you find out the opportunity you want, the location closest to you. She'll help you even complete your application and schedule a phone interview if that's what you want as far as next steps as well. I do, as I said, have my contact information. I know Ezra's going to give you some information too. So if you want to reach out to me directly, if there's an opportunity that just sparks your interest. And as I said, even if you're not local, even just a position that you're like, hey, this is local to me. This is a leadership position. Like, what could I expect out of this? Like, if there wasn't much of a description, like, can you kind of give me an idea of where in the community does that what would my objective be, like, what, give me more information about what this job would look like, then I'm happy to help you with that as well. So some final tips and kind of takeaways, from the call today, of course, is just long-term healthcare is so in demand right now. So no matter your discipline, there's always a place that you can kind of find where you're needed, particularly in this role. And as I said, even with home healthcare and hospice as well, we just need a lot of different people from a lot of different disciplines. Um, of course, with long-term healthcare, it's going to require that you have some compassion, that you're really all about the mission-based work of caring for our residents and the senior population. Really got to have a love for that, because it's not always the easiest job, but it's just so rewarding, and that's why a lot of us tend to really stay in this industry for a really long time. The long-term healthcare environment also definitely has the biggest collaboration to promote, um, just different disciplines, different studies. You meet all different people of different walks of life. And the one thing that I said that we really have our biggest brag in long-term healthcare is that we do have the ability to just build those long-term relationships with our residents. And that's what all our staff really love. They love that they know their person, that they know them, and that it just makes them feel so much better about going to work. And they're like, I can't wait to see, Miss Susie today. So, I mean, that always just like makes their work 10 times better. Um, as I said, as compared to other, healthcare aspects where maybe that's not the case. As I said too, long-term healthcare, of course you're going to need the hard and technical skills and those licensures and everything, but it really requires just major soft skills, that compassion, that need for active listening, the need for collaboration, the need to be flexible. Just all those things really come into play in working in a long-term healthcare environment. And then, as I said, if you are curious about long-term healthcare and what that could look like for you as far as like your career goals and what you're hoping to develop with your career, just learn more about the environment, connect with a professional, come take a tour, volunteer sometimes. Always looking for volunteers to help in activities. And I will tell you, activities is one of the funnest, like most fun environments ever. I still love to do it. I love doing bingo with them. Like it's just a cute and it's really fun. So just always, feel free to like spend that time really kind of seeing if you would like the environment, if you would like the culture of your local building. And then, of course, research the credentials for each role. If you're coming from business or whether you're coming from nursing or social services, really kind of check out the leadership role and what they require. Sometimes we, with our directors of marketing and admissions, for an example, we don't always require that they have long-term healthcare experience. Sometimes if we're like, hey, they've worked in admissions before, they're really good at sales, they can really put themselves out there and connect with the community and really connect with those referral partners, then we're like, hey, like we can teach the rest of the stuff. So that's something to take in consideration. And then also just, as I said, building on those leadership and critical thinking skills. So whatever, you can find to do that, I always ask people to, whether it's your mentors that you work with, your instructors, your cohorts, your colleagues, seek that feedback, use those active listening skills, use that validation therapy where you're validating people's feelings before you even think of the next thing that you're going to say. Um, I know it sounds simple, but it is a very it's a lost art. It is sometimes. So it does take the willingness to practice those skills. And then also just network with not only like disciplines, but also just other professionals, and really take on those leadership positions and opportunities with different associations to kind of get your feet wet a little bit on, okay, what could I bring to the table? How could I already pose as a leader before I go on to that leadership position in my next career move? That's what I did. I volunteered a bit, as I said, for a board, and it really gave me the opportunity to kind of lead, really practice those leadership skills before I was even promoted to a leadership opportunity. So just keep that in mind as like maybe some skills that you can work on while you're even like kind of finishing up your education. And not only will you build on those skills, but it'll give you such a great networking foundation and people you can go to and colleagues you can ask for either help, mentorship, or even maybe for your next opportunity. I'm going to give us a little bit of time, of course, because I want to, kind of stop for questions, of course, but I also want to make sure you really had access to my contact information. If you feel like you have other questions about long-term health care, what the environment's like, what skills you can kind of build on, ways to network, even, if you need help with resume prep or, or even mock interviews, I'm here for you. I love connecting with students. It's what I do all the time. I really develop a lot of our early talent pipelines. So I'm constantly talking to college students in the different ways that they're kind of going through their pathways to their career. So I would be happy to connect with you. I think Ezra's going to add my LinkedIn profile link as well. But here's my phone number, as well as my email address. And then I just posted there too. If you want to get on a call, schedule a call with me. We can go over more questions. If you do connect with me on LinkedIn, excuse me, then there's also at the top there a way to book an appointment with me as well. Okay. But I'm happy at any moment in time that you're ready, Ezra, to take any questions.
All right. Well, this was absolutely fantastic. Thank you, Jenny. I think it's it is sometimes so forgotten and hidden, but long-term care, man, yeah, such an in demand, right? And stable, like you said, very stable.
It is. It's very
um,
stable, very in demand. And I will say too, like, and I probably didn't have this point come home, but I know when I was finishing up with my certification in nursing assistant, and I see that a lot when I talk to my nursing students, that as you said, like long-term healthcare is kind of hidden a little bit. Like, unless we have clinical rotations, some of our students will know us. But I feel like a lot is pushed into acute care and hospitals, and students already have like some of that involvement in hospitals. So yeah, it's like a hidden industry, but very much in demand and very much needed for our people.
Agreed. Very much so agreed. All right. And we are going to open it up to questions. I haven't seen any in the chat yet, but feel free to drop in if you have any questions. And while we wait, because I always forget to do this, I'm going to drop in just a quick survey link. This is for our career and professional development team. If there are any other topics or organizations you want to hear from, it's like a 2-question survey that you can complete. And that information just helps us continue to bring different folks in and have these awesome sessions. So, and then, yeah, and I will say while we wait for questions, maybe I'll ask the first one, Jenny. I know you mentioned volunteering and job shadowing. And I love that you guys are open and offering tours. You don't see that in every industry.
No.
But what other sorts of experiences have you seen where current students can get experience, whether it's part-time? I know I've heard of externships versus internships. I don't know if you could maybe talk a little bit more about those opportunities as well, both on the clinical and non, administrative side.
Yeah, Ezra, that is a great question. So, of course, volunteer is one thing, but as you said, if they're looking to really just give um, that active like experience, I always really tell my people, especially if they're coming. So let's do it from the clinical aspect, and then we can do it from the non-clinical aspect. Is that okay? So I always tell my nursing students, particularly, if you don't know what it's like to work in long-term healthcare, um, and you want to kind of see what the environment's like, but because a lot of them, especially in nursing, they will be already on their way to get their CNA certification. But some of them are like, hey, like long-term healthcare, I'm not quite sure, like what's a good way. And so I would say if they have time for a part-time job, activities assistance is one that I constantly recommend. It's just a fun job. It's really a great way to connect with the residents one-on-one or even in a group setting. They really understand like the comings and goings of like all the different disciplines, especially clinical. They're able to see the nurses, they're able to see the CNAs, they're able to kind of assist them in their work as well. So that's always a great job opportunity that I just love to tell people. Like, if you kind of want to play with a little bit of the environment and you're not quite sure, activities assistant is a great one. Because right, it's not too intimidating. It's really not. You're doing activities and programming and fun stuff. Um, but at the same time, it still gives you kind of an idea of what the environment's like. I always try to too, and I'm sure a lot of people are like this. Um, we would have not only clinical rotations for our clinical students to where they're in the building constantly working with our people, but we would even have like just a student networking night. So we would just have an opportunity where they can come, maybe do a tour, maybe we even have it offsite. I'll connect with a lot of our student nurse associations as well, just doing different events. So it kind of gives them a flavor a little bit. Sometimes we'll even do a speaker series where we'll talk a particular topic that's really important. Like for us, sometimes memory care is really important. So we'll talk over like, stages of Alzheimer's disease and that type of thing, or different therapies for people with dementia. So there's a lot of different opportunities that we even try to bring up of just like a networking night, a speaker series to where they can be in the environment but don't feel so pressured, right? To already just be caring for those residents and that type of thing. I would say even with my non-clinical people, um, the opportunity to come and as we said, kind of volunteer, but then I would still recommend the same thing of if they're looking for maybe a part-time job or even a call as needed job, activities assistance is a great one to start with. That's even on the clinical, but on the non-clinical end too. We don't always necessarily require our activities assistants to be certified in CNA. Sometimes, we do, but not always. So even just getting that environment, understanding what that's like. And as I said, even just kind of working with some of your local associations. As I said, we provide those tours, we provide different community nights where they can come in. And there's no pressure to provide care, right? Because that's not really what the focus is. The focus is just to kind of introduce them into the industry. So that'd be a couple of different ways where I would say, and I'm sure we're not the only ones who do it too. I'm sure other companies do that. I would say really connect with if you don't have an ASC near you, connect with a like organization like ASC, like just a skilled nursing company. Follow them on social media, see what their community nights look like, see what their open houses look like, and then go from there.
I love that. I think that's such fantastic advice and agreed on the activities. I once organized a very long time ago a Valentine's Day party for our local senior community,
Oh,
and
I
it was
love
super
that.
fun. It was super
I
fun.
love
So I love
that.
that.
And see, wasn't it fun? It's so fun.
Yes.
Like, and I will tell
It's
you
great.
right now, and I know, because it goes both hand in hand, like sometimes, you're like, if I want an internship or if I want a job, like I almost rather do the job than volunteer because you're not going to get paid, like you may not get paid, or even with the internship, maybe you get paid, maybe you don't get paid. But I would say if there's anything that you're wanting to give back to a community, whether that's hosting a Valentine's Day party or hosting we've had people want to host a senior prom, um, like a
Yes.
senior prom, right? Um, we've had people during winter time, like I just want to knit scarves for them, or just anything like that. No one's going to tell you no. Like no one's going to tell. Like we love it all. So
I love that. All right. Any other questions we have just a few more minutes here. So just want to make sure I didn't miss anything. And then I don't see any questions here. So I think you covered everything
right,
super
hopefully
awesome,
that means
Jenny.
I accomplished it all.
Um,
But if you do have any, I am more than accessible. Please connect with me on LinkedIn. Please call me, text me, whatever. I'd be happy to hear from you.
Yes. Well, thank you so much, Jenny, for the session, for all of the information that you shared in your time today. A really big WGU thank you. That concludes our session today. If you haven't already, please take a moment to use that survey link. Let us know again what other things you want to hear or about or from. And then this session again was part of WGU Winter Career Quest. We have lots of more sessions coming up. I know I'm doing another session later tonight. If you are on the nursing side, we're going to be talking about salary and contract negotiations, a very fun topic.
Yes.
So definitely check that out as well. And all of our events are on Handshake. And then I will send our recording and Jenny's contact information again out after this. Once we end this call and the video processes, I'll send that all out to you as well. But again, thank you guys for being here, for joining us. And again, thank you so much, Jenny, for your time.
Of course, my pleasure. Have a good night, everyone.
All right, take care, everyone.